Today we're going to talk about long-term care insurance. When I talk to clients, I get a lot of different opinions about long-term care, especially between men and women. A lot of men I have as clients tell me that their preferred method of long-term care is to walk into the woods and never come back. This may not be the best plan or work out the way that you would want. So let's take a look at what are other options for us to cover this expense. First, let's talk about who needs long-term care and how we define what long-term care is. Long-term care is defined by getting a doctor's note stating that a person is unable to complete 2 out of 6 activities of daily living, or ADLs. ADLs are everyday tasks like bathing, eating, walking, going to the bathroom, etc. 70% of people who are age 65 today will deal with a chronic illness like Alzheimer's, a serious stroke, or debilitating arthritis that would qualify them for a long-term care coverage. In the early stages, 80% of long-term care is given by a family member, a spouse or a child. However, things can quickly escalate to the point where skilled nursing is necessary, and most people would prefer to stay in their home as long as possible. The estimated average out-of-pocket cost for a couple age 65 years old today is $285,000. At-home care and facility care are very expensive. So let's discuss what options there are for covering this need. One is you could self-insure. This is unfortunately the most common option we see. It's not a great plan because it's usually a poor way to leverage your assets. You could unintentionally run out of money or spend all the potential assets that you would have rather given to your beneficiaries for a few years of expensive but very low quality life. Traditional long-term care coverage. This can be a good and effective solution. However, most clients do not like the use it or lose it nature of traditional long-term care. This is the reason why most people choose not to buy this insurance, because if they pass away due to a sudden event, they will have paid for insurance that they never use. So this brings me to the third option, and one that I feel most of my clients are finding the most attractive. It's a hybrid life insurance policy combined with long-term care. Let me explain what this means. In essence, you're buying a life insurance contract where you can access the death benefit early if you need it for long-term care. I'll give you an example. If you have a $300,000 death benefit policy and you qualify for long-term care, you could receive up to $6,000 per month to cover your stay-at-home care or for a facility. You could also choose to take $70,500 per year for 4 years and use that as a way to cover your long-term care. And the way that this works is it's a dollar-for-dollar drawdown on your benefit. So for instance, if you have $300,000 death benefit and you need to use $150,000 of it while you're alive for long-term care, your beneficiary still will receive a tax-free payment of $150,000. So someone's always going to be able to utilize this insurance coverage. That's why I feel like it's a great and very effective way for our clients to meet their long-term care needs. Thank you.